Okay, so my name is Emily Shara, and I'm going to be talking about epilepsy, and I am reading slides off of my phone. So, what is epilepsy? Epilepsy is a neurological disorder marked by sudden or reoccurring episodes of sensory disturbance, loss of consciousness, convulsions, or, or and association with abnormal electrical activity in the brain known as seizures. So, what is a seizure? A seizure is an uncontrolled electrical disturbance in the brain or a sudden urge of electrical activity in the brain. So, what causes it? In newborns, it can be caused by brain malfunctions, a lack of oxygen during birth, electrolyte problems, inborn errors of metabolism, intracranial hemorrhage, or maternal drug use. In infants and children, it can be caused by fever, which will lead to febrile seizures, or rarely it's caused by a brain tumor and sometimes is caused by infection. In adults, it can be caused by congenital conditions like Down syndrome, genetic factors, or head trauma. And in seniors, it can be caused by a stroke, Alzheimer's, or trauma. So, what are the different types of seizures? There's a focal seizures or partial seizures, and it occurs when seizure activity is limited to one part of the brain hemisphere, or there's a site where the seizure begins, like, for example, the right temporal lobe. And then there's generalized seizures, which are seizures that are all over. There's not one specific part, and there's different types of general seizures. So there's absence seizures, which are known as petit mal. There's tonic-clonic or convulsive seizures. There's grand mal, atonic seizures or drop attacks, clonic seizures, tonic seizures, and myelonic seizures. The most common type of seizure is the grand mal, in which the person will lose consciousness and usually collapse. So, how do I know if I have it? You can get an EEG or an electroencephalogram, which is the most common type of test. Your doctor will place sensors on your brain or on your head, which will record the electrical activity in your brain, and just look at the brainwave patterns of a normal brain compared to yours. And if there's a difference, then that's a symptom. Many people with epilepsy have abnormal EEGs. There's a CT scan or computerized tomography, which uses x ray images to take pictures of your brain, and it'll help the doctors rule out other causes of seizures like tumors, internal bleeding, or cysts. And then there's an MRI or magnetic resonance imaging, which will let the doctor see the structure of your brain that could lead to damaged tissue, which would cause seizures. So, how to treat it? There is surgery where you can have that portion of the brain removed if it is a focal seizure, like the right temporal lobe. But the problem with that is you could remove an important part of the brain that controls things like movement or language. There's anti-epileptic drugs, where you usually get prescribed one medicine at a time at a relatively low dose, and then they increase the dose until seizures are well controlled. You take the medicine exactly as prescribed, and you have to call your doctor before you add other prescription medicines, over-the-counter drugs, or herbal remedies, and you should not stop taking the medicine without consulting your doctor first. There is a implant that you get put in your chest, and it runs up to your brain, and it's called a VNS, or a vagal nerve stimulator, and it's kind of like a shocker. Like when your brain starts having a seizure, it'll send a shock all the way through, and it's sort of like a pacemaker for your brain. And then there's a ketogenic diet, where it's a high fat, low carb diet that helps control seizures, and it's for kids who have not responded to multiple seizure medications. 3 to 4 grams of fat for every 1 gram of carbohydrate and protein. And then some interesting facts is 3 out of 10 people have a change in the structure of their brain that causes electrical storms or seizures. 3 out of 10 kids with autism also have epilepsy, and epilepsy is more common than autism, Parkinson's, cerebral palsy, and multiple sclerosis combined. That is epilepsy.